privacy, we do ask that you ask questions in the chat box rather than out loud. That way your answers or your questions and answers can be given anonymously without your name attached or any details attached. And so when you ask those questions in the chat, we will keep a list. And at the end, Dr. Hansen and Hannah will answer them for y'all as we wrap up. We do have some questionnaires. It would be great if our folks today would answer some questions for us. The questionnaires at the beginning are just seeing what your knowledge of early intervention is, and if you have any questions. And then at the end, we would like you to fill out a satisfaction questionnaire or survey. And those go to our funders, who are the Alabama Council on Developmental Disabilities. They have funded us now for 2 years, which is wonderful. It means we've been able to provide these presentations with simultaneous interpretation and highly qualified presenters for 2 years. And so this helps us to build our public profile, lets our funder know that we're doing a good job, that you are enjoying the presentations, hopefully. And if you're not, we still want to hear about that too, because that helps us to plan better programs for y'all. So those questionnaires are in the chat, and then we will send some more at the end. So if you could click on those, they're available in English and Spanish. All right, I am Dr. Christine Drew. I am an assistant professor at Auburn University. I do research on challenging behavior for adolescents with intellectual and developmental disabilities. And I also research sexuality and relationship education for people with IDD. And I'm lucky enough to work with Dr. Doris Hill and Maria Gutierrez. Dr. Hill.
Hi, everybody. I'm an associate research professor, and I'm the director of the Regional Autism Network, and I work hand in hand with Dr. Drew and Miss Gutierrez, and we are like the, what do you call it? The three amigos a lot of times. And my area is positive behavior supports, autism spectrum disorder, global disability issues. And I think that's enough for right now. And I'll pass it off to Miss Maria.
Hello, everybody. My name is Maria Gutierrez. I am the family navigator for the region number 4. We cover 20 counties, and I am also the parent of a young adult on the spectrum. So I am happy to see so many parents here and professionals. So thank you for taking time of your evening to be here with us. And now I would like to pass it to Miss Sarah. If you could tell us a little bit about yourself, and then next will be Miss Hannah.
Remember to unmute. My name is Sarah Hansen. I am an assistant professor at Georgia State University. I got my PhD at University of Oregon, and my research is about early autism. So I work with families and young children with autism to work on social skills and other important early skills. And I will hand it off to my doctoral student, Hannah.
Hi, everyone. I'm Hannah Etchison. I have a master's of education in early childhood special education. I'm a student at Georgia State University, working on my PhD right now. My areas of interest are ABA therapy, as well as early intervention in rural areas. And I'm excited to be here with you all today.
Wonderful. And Hannah, if you're ready, you can share your screen and we can get started. Just a fun fact, Dr. Hansen went to school with me, so she's known me for a while. And so I'm sure if you ask nicely at the end, she can tell you some funny stories if you want.
Okay, so Hannah, do you want me to get started and do the first few slides and then I'll hand it off to you? Great. So we're going to talk to you tonight about early intervention, sort of what that is as a concept, what is available in early intervention. We're going to go over some basic strategies that might be helpful if you're working with young children or have young children. And then Hannah has very nicely put together some resources, which we have available as a handout that we'll walk through with you, just sort of resources that are available in the state of Alabama. So early intervention is services for young children under the age of 3. And it's covered by something called the Individuals with Disabilities Education Act, or IDEA. You might see this on some paperwork. And there's a particular part of this called Part C that mandates that children who are eligible under the age of 3 get services and supports to help with either a diagnosed disability or a delay, meaning their development is just slightly behind by a certain amount. For children in Alabama, this is done through the Alabama Early Intervention System. Move forward. So there's 2 main ways a child under 3 can become eligible for early intervention. Some children are born eligible for early intervention, and you're born eligible for early intervention if you're born with certain syndromes. So Down syndrome is one example. Cerebral palsy is sometimes an example of this when it's diagnosed at birth. Sometimes we don't know about that till a little later. If a child's born significantly premature, they automatically qualify for early intervention services. And if they are born blind or deaf, they automatically qualify for services from birth. Sometimes children become eligible for early intervention anywhere from birth to the age of 3. So this usually comes up if it's noticed the child has significant developmental delay, or they become diagnosed with a developmental disability. So they get an autism diagnosis or something like that. And or they can exhibit 25% delay in at least one of the key developmental areas. So if a child becomes eligible for early intervention services, early intervention is generally delivered in a family-based way. So this means that your early intervention service provider or providers will work with the family to decide what the goals are and work to support the child in the home environment. So services are based on the area of need, which usually is tied to how the child became eligible for services. So for example, if they are eligible because they have an autism diagnosis, this might mean they need some support with communication and language, or they might need some support with challenging behavior, and the appropriate professionals will be consulted or will work with a child directly, depending on the model that is being used in your particular county. Early intervention services in general take place in the home. IDEA, that law that we mentioned earlier, means that children with disabilities get services in their natural environment. So when we're talking about school-aged kids, this means they're in the classroom with their peers to the largest amount possible. But when we're talking about very young children, their natural environment is home with their parents or caregivers, siblings, etc. So usually early intervention services, with a few exceptions, means that you get help at home. Parents and caregivers work directly with service providers to determine goals, both for the child and for the family. So this is a little different than it is when kids get older and you're at school. When you're really working on goals where what does the child need to be successful at school? In early intervention, you're working on goals for the child and the whole family. So basically, how can early intervention service providers support the entire family unit to allow the child to access the best possible outcomes? These goals come together in a document called an individualized family service plan. And we're going to talk a little bit about that. If you'll notice, early intervention, much like special education, loves its acronyms. So you'll often see letters used. So I'm going to try my best to say these out loud every time, because I know if you're just getting used to this, it can feel really overwhelming. An IFSP is a document used to make sure a child's family and service providers are on the same page about goals. So this means that usually a pretty long, in-depth discussion where the early intervention service provider is going to observe the child. They're going to assess the child. They're going to come up with kind of a marker of what the child can really do and what they can't yet do. And then they're going to share what they've noticed with the family, and together you guys are going to come up with a plan for what are the most important goals and how are we going to address them. The IFSP will include a summary of, like I said, of what the child can do and can't do yet. And it'll highlight those goals, and as well as the goals, it'll highlight on who's going to help the family reach those goals and how everyone's going to know when those goals are met. So there'll be a way to sort of mark down how that's going along the way, so you know when you've made it. The IFSP will serve as sort of a agreement moving forward about how those goals are going to be reached. Would it be helpful that if I went over the questions we've received so far now, or should I save those for the end?
Probably let's leave those for the end.
Okay, perfect. Mm-hmm. All right, Hannah, take it away.
Hi, everyone. So I wanted to go over some very general strategies for working and living and teaching children with disabilities or delays. So these may or may not apply specifically to your situation, but hopefully there will be something in there that is a little bit helpful, and we can elaborate more if you have specific questions. I wanted to start with behavior first. We often have children with disabilities display behavior that we would rather not have to deal with in some ways. So this could be something like hitting or screaming or well, any kind of behavior really is going to fall in this category that you don't want to see your child participating in. So the important thing to remember is that all behavior is trying to tell you something. So it's a message from your child. And a lot of times they are using this problem behavior because they do not know how to tell you what they need. 4 of the things that they might be needing are attention. So they may want you to be talking to them or playing with them, or sometimes they even like it or want that attention of you telling them to stop doing something. So attention can be positive or negative, but either way, if a child is trying to get this, they may act out. They also may be trying to escape. They might be trying to get away from what they are doing or the environment they're in. So this could be a child who is in a noisy environment and is overstimulated and doesn't like the noise. So they cry and scream until you take them out, and then it stops, right? When they're out of that environment, it usually stops. Or it may be them trying to get away from doing cleaning tasks or chores at home or academic tasks. Another reason a child may be misbehaving is they want something like food or a drink or a toy, or perhaps they want to play with your phone or your iPad. You know, kids always want something that they can touch and manipulate. So it could be anything like that. It also might just be that the child is doing something because it feels nice to do it. Sometimes we have kids who exhibit stereotypy. And this could include like hand flapping, you'll see often, or vocalizations that aren't really words, or maybe they're just repeated words that don't have much meaning. So a lot of times those are done, they can be for any of these reasons, but a lot of times those type of things are done because they just feel good inside to the child. But the main thing to remember is that whatever the child is doing, or whatever anyone is doing, is always trying to tell you something. So we want to look out for what they're trying to tell you and teach them appropriate ways to tell you that so that you can meet their needs. And one way to meet their needs is to teach them how to communicate. So it would be easier for everyone if the child could just say what they want instead of screaming or hitting or flopping to the floor. We obviously don't like it when that happens, especially when we're out at the grocery store or something. We want to try to get our child to, you know, cooperate and behave and be safe. So one way to do that is to teach them how to ask for something. So if your child may or may not be talking yet, they may know some words or not any words at all, but they still have ways of showing you what they want. So if they do talk and you can tell they're upset by something or they're doing something that they should not be doing, you can either show them what to say by saying it, or if they don't talk, you can have them point to an item, like you can say, what do you want? And then point to the item that you know they want and show them how to point. And then when they point to it, or if they use sign language, or if they use a picture exchange system or a speech generating device, which is like an iPad that tells you that they click on pictures and it will tell you the words. If they use any of those things, it's perfectly fine. It all works pretty much the same way, in that when they engage in the appropriate behavior, you want to immediately give them what they want. And sometimes that's harder than other times. Like obviously in the grocery store, you can't go opening packages and giving them whatever food they want. It can be very challenging. And I know this is not going to work in every situation, but you want to show them that getting their way is easier when they use some kind of communication instead of acting inappropriately. And later on, you'll want to teach them how to wait. But sometimes the first step is just getting that response that shows them exactly what they want and how to get it. And it may take several attempts for them to understand, so be patient. And I can answer more questions about this at the end. For learning things, because even children out of school are always learning. Even our little guys are learning faster than we can keep track of sometimes. But depending on their level, they may need you to wait longer after you ask them a question. And that just gives their minds time to process what you've said and how they're going to answer. So sometimes with a child, you can say, hey, what's your name? And immediately they will be like, oh, my name is Maria. or whatever their name is. But sometimes it might take them longer to think about, well, what did she just say to me? And how should I respond? And so we want to give children that time. So sometimes you want to count to at least 10 or 20 before you ask again. Another thing that really helps kids with disabilities and delays, and actually it helps all kids, is to have firsthand examples and concrete ideas. So instead of showing them a picture of a bicycle and making them say bicycle, it would be better to show them an actual bicycle if you have one available, because that will help them remember it more clearly when they're able to put their hands on it and see it in action. And it's a little simpler to understand than like, oh, this piece of paper is a bicycle. No, it's the picture on the piece of paper. That can be confusing. A lot of kids will need more practice than maybe their siblings needed, or maybe other children you've seen pick up skills really quickly. But it may just take a longer time and more practice to have your child learn a new skill. So that's something to keep in mind. Another thing that happens with children with disabilities often is that they can be overwhelmed by sensory stimulation. So this could be noises, or it could be something uncomfortable on their clothing. It could be a texture they don't like, or a smell, or a taste, and they're just very sensitive to it. Or even sometimes when the lights are too bright, it can bother a child and they may not know how to tell you to turn down the lights. So it's important to be very aware of your child's warning signs if they start to feel uncomfortable, and to do something about that discomfort. And some things you can do are find more comfortable clothes, or cut the tags off the clothing that might be itching their back. You can dim the lights or put cloths over your lamps so that they're just not so bright. And then another thing that I've had great success with when I was a teacher is using these headphones. So these will make the noise much quieter, but you can still hear people talking directly to you. So it might help when you go to a large gathering with lots of people. You might want to have something like this if your child is sensitive to noise. And there's a lot of other strategies you can use for children who have disabilities or sensitivities to lights and sounds and smells and all that. But it just is going to depend on what your child needs. And your IFSP team will be able to help you figure out what those needs are and how to help your child cope with those. I also want to go over some resources. I talked to someone who works at the University of Auburn. Auburn University, I should know that. And they showed us, she showed us a lot of resources that exist in Alabama. And one of the most important ones is if you suspect that your child has a developmental delay, or if a doctor tells you that they have this delay, you can call this number. This is the English number here. And then if you want to speak in Spanish to someone, you can call this number. And if your child is younger than 3 years old and needs these intervention services, they can help you access them. The information you will need to provide them is here, your child's name, date of birth, social security number, your name, your address, your phone number, and if possible, your doctor's name and their phone number. And this is all in a handout that will be given out, so you don't have to worry about writing it down. I'm also going to show you some document that we have that has a lot of resources that are available in your local community around the Auburn area. So some of these may be in Georgia, like in Columbus, but they may be helpful anyway. And then a lot of them are in Alabama. So I will be. All right, can you see the resources for families of people with special needs? Awesome. So this section is called advocacy, and that means it's people who will help speak up for your child and your family if they need something through the schools or if they require help that they're not getting. So if you have a big problem, one of these services may be able to help. These are some government services: the Council on Developmental Disabilities, Department of Rehabilitation Services, and then the university also has some services. Yeah, Dr. Drew is celebrating that she's on here, which is awesome. And there's also these, well, this is a very long document. I'm not going to go through everything. But there are a lot of resources under advocacy as well as behavioral. So Children's of Alabama is obviously in Birmingham. It's the big hospital, but they would be able to help direct you potentially. And then there's behavior. Usually these are, ABA services, which is very evidence-based way of teaching your child new skills and how to cope with things, as well as communication. So these are several of those. There are some camps. One of them, I believe, is in really close to where, I went to high school. So it's on a lovely lake, and let's see, there are several here. So these are like summer camps or maybe weekend getaways for kids with special needs. There are also daycare and day programs. This might be more for older kids. You see this one's in LaGrange, so not too far from Auburn. If your child needs help with feeding, there's a section here, and there's Auburn again. Auburn is very represented on this list, which is awesome. There's hand therapy, hearing, if your child needs cochlear implants or sign language or anything like that. Job training, you guys probably have younger children, so maybe this isn't on your radar yet, but one day it will be, so keep it handy. Occupational therapy helps with a variety of things, and it is usually offered through schools as well as private organizations that may take insurance. Post-secondary, we'll leave that for a little bit later. That's a little that's a little farther on, but there's a lot of there's activities like social activities and art activities here. A lot of those actually. Physical therapy. If there's a possibility your child may benefit from having a service animal. So there are some organizations for that, as well as speech therapy, which is can be very helpful for children with disabilities. And there's other support systems here under support, which can help with affording medical equipment for your child if that's needed, or maybe just a beneficial group to share your experiences with. And that's that document. And I also wanted to show one more document. And it is this guide. Can you see the eligible families guide? Cool. And I'm not going to go through this too long, but it is here. If I don't know if they have it in Spanish or not, but this is the one I was shown. But it shows the 3 steps in the child find system, which is what Alabama uses. So it's identification, and a physician or a doctor may have to identify your child, or if you suspect that they have some kind of delay, then you can contact this number here. So this is that same number I showed you on the slide. As long as your child is younger than 3 years old. If they're older, you may need to contact the school system. And then the child find will process the referral and they will give you directions from there. And this actually has a developmental checklist for young children. So that can help you know if your child is developing at a typical pace, or if they slow down at any point. You can track that with this list. And it's pretty long too. But that is all I had to share as far as resources. And I hope that's helpful. And now we have time for questions, I believe.
Thank you, Hannah. Yes, I've been sending the questions to Dr. Hansen.
Okay, so I will read out the question, Hannah, and I will start answering it. If you have anything to jump in with, feel free. So the first question is, can children who are not born in the USA but are living here in Alabama be qualified for these services as well? Will it be a cost since, will there be a cost? And no, early intervention is a government service, so it is free of charge to the amount which you're qualified for. So you should not have to pay for basic early intervention services. That being said, there's certainly practitioners of these types of services that you can pay for. So if you're not getting enough and you have the resources, you can always buy more. But the basic amount that you can get from early intervention should be available to you. This question says, can you give some examples of what developmental delays are? Yeah, so most of you probably, when you've taken your child to the pediatrician for like well child checkups, you may not have even noticed, but they are actually assessing your child's development. They use a version of something we call the Ages and Stages questionnaire. And if you're ever curious about this, you can actually use it on the Ages and Stages questionnaire website, which I will. Hannah, are you able to Google that really fast and put the link in the chat? Oh, Christine's got it. There's a free version online and you can take it for the correct age of your child. And while the research team that's running that website is Oregon-based, they will help you get in touch with somebody if your child screens as needing more support. So what something like a developmental screener does is it just gives us a first glimpse into a way to answer the question of basically like, do we need to take a closer look at how your child is developing, and might they benefit from something like early intervention or from more support? That's always a good place to start. Again, during well child checkups, your pediatrician does use some version of this. But if you have concerns, if you feel worried about whether you don't know whether something's normal or not, this is a really good place to start. And then that child find resource that Hannah shared is at the end of the PowerPoint is a really great place to access direct support for where you are. they'll know how to help you in Alabama. So some examples of a developmental delay might be your child might be a little slower to talk than other children. You might notice they're not, if you have older kids, you might notice they are not quite developing on the same track as your other kids or kids that they know. You might see a motor delay, so slow to walk, slow to crawl, things like that. What's important to remember is that development is all based, what we know about typical normal development is all based on average, right? So it's based on us looking at a bunch of kids and saying, okay, on average, usually this is how children develop and grow. So sometimes it might seem like your child is taking a lot longer to talk or walk, or they might not crawl, they might go straight to walking and everything's fine. But it never hurts to follow up if you're worried about something, and just get some information about whether it's significant enough of a delay that you might benefit from some extra support.
Would it be helpful to put the MChat also in the chat?
Yeah, the MChat is a great, so just like the ASQ is sort of a first look at whether we need to take a closer look at their development, the MChat does that specifically for autism. So if you are worried about autism, it takes about 15 minutes. I believe it's available in many different languages, as is the Ages and Stages questionnaire. And it can kind of just give you a starting point to talking with somebody that you're worried about your concerns, because it'll give you a marker of where they are.
I didn't mean to interrupt too quickly, but I just wanted to say I put the Qualtrics survey back in the chat, as well as the ACDD survey, SurveyMonkey. So, and that is in English, Spanish, and Korean. Again, that goes to our funders. I usually like to post it during the question and answer session because people, while they're listening, can fill it out.
Yes, do fill that out. This is such a great thing. So fill it out.
And really quickly, the other thing to think about is if you are noticing that, you know, your other child was feeding themselves by a certain point, or taking objects and putting them in, or opening lids, and your other child is not doing that, or you have a friend over and they have a child of the same age, you may be seeing some things that you know, your child may be behind. And so it could be that your friend's kid is just wildly ahead. They're so far ahead. But this will let you know whether that kiddo is just really far ahead or if your child might be having that delay.
Yeah, and something like 85% of parent concerns about child development ends up being valid. So I would say it never hurts to trust your gut. If you're worried about a delay, just get a professional set of eyes on it in some way. Talk to your pediatrician, complete the Ages and Stages questionnaire online. You know, talk to somebody that you think can help you with it. Call the child find number. These are all things you can do, and just, if nothing else, get some peace of mind. And what we know is the earlier you start working on problems, if there is a problem, the easier it's going to be to work them out. So I just always tell people it's never silly. It's never a problem. It's always something to address. Your intuition is probably right. Okay. If parents work and can children also qualify? The question is, can children also qualify if the child only has a delay in speech and language? Yes. If the delay is significant enough to qualify for services in speech and language, it is sufficient enough to qualify them for early intervention. So it can be in just one domain, is what we call it, but one area of development. So maybe, you know, you have a child who's walking, running, manipulating objects, doing everything else on schedule, but you're just not hearing their voice, they're not talking, we can get them some support. The next question is, if parents work and the child is in daycare, can he receive the intervention at the daycare center? Yes. So your child is allowed to receive services in what's called their natural environment. So if their natural environment on an average day is at the daycare center because you work, that is where they get to get services. And the early interventionists will work directly with the daycare providers to give them strategies and supports. So you think about where your child spends most of their time, that is the place in which they can receive services. The next question says, how many hours is the maximum families can receive for early intervention? I heard many families only get 1 or 2 hours a month. Is there a way to request more hours? So how early intervention works is it's a little bit different from special education. So in special education and school, your child is mandated to receive as many hours as is required by that IEP, that contract that you write with the school district. Early intervention is funded, but not mandated in the same way. So what that often means is, like many resources that are really useful, it's not funded as much as we could use. And so the number of hours you get is going to depend on what resources are available. It's going to depend on your child's needs. So what type of services they require and what type of service providers are available in the area. And it's going to depend on how much services they need. Oftentimes, unfortunately, it does look like not as many hours as we'd like. But that is why part of what your early interventionist is going to do is give you all these strategies, all these supports, all these things to work on. And you're going to have the tools to be working on this when your early interventionist can't be there. And that not only gets more hours of service delivery for your child, but we think they might learn better through you because you're the one that's there at mealtime, you're there at bath time, you're there at bedtime. And these are all wonderful times to work on these skills. The next question is, does insurance cover these services? And how about Medicaid? So these services are available regardless of insurance. That being said, autism, actually, Dr. Drew, this is a question for you. Are autism services covered by insurance in the state of Alabama? Yes?
Yes, they are difficult to procure depending on where you live. So just like I'm sure in Georgia, if you live more rural, it's a lot harder to get folks out to do ABA or other services, which is why I think a lot of people end up really needing early intervention support. If you live in a bigger city, if you live in Birmingham, there are, and even Montgomery, there are clinics, but I think Auburn only has a few. And so, yeah, we can always use more BCBAs.
The insurance covers is valid in companies that have 51 or more employees, and that's been since 2017. That's for like Blue Cross Blue Shield. Medicaid was passed in 2019, and like Dr. Drew said, some of that is we're still in the capacity building stage.
Yes. But insurance can sometimes help with getting more services for kids with autism. Some speech language services are covered by insurance. Some insurances, it depends. So there are aspects of this where you can get potentially more help. through insurance. The next question says, my child is still limited verbal skills, but early intervention helped me learn so much. That's great. That's what we like to hear. That is the beauty of early intervention. The next question says, if the child is almost 3 years old, 28 months, can she still qualify? This is a great question. So this is again going to depend on how long it takes the child to be evaluated and what the capacity is of the early intervention providers in your area. But I would not wait just because your child's close to that 3-year-old birthday. I would start the process now. And it could be that this just ends up being really useful assessment to place them appropriately for preschool. So just because you're nearing that 3-year-old birthday doesn't mean wait until it comes. I would get started now, and it could be that they never get early intervention services in time, but it's still going to get you on the right track to getting some support. So this is a great question. It says, I feel like when I'm giving my child what he wants, it feels like bribing. My family does not understand, and I feel like I'm failing. This is a very difficult aspect that comes up when you're trying to help your child communicate their wants and needs, right? But what can feel like a reward or a bribe can be used really effectively as what we call a reinforcer. If a couple things are in place. So one, this should be something as much as possible, especially with really young children, that is embedded in whatever you're doing, right? So the reinforcer becomes another cookie at lunch, or the reinforcer becomes access to their iPad once they've sat still, so you can buckle them into the car seat. And that way you're kind of using things that are already in the environment and already available to you. And it feels less like, if you behave at grandma's, I'm going to give you this bag of jelly beans, which starts to feel kind of like a bribe, right? The other thing is, remember that what you're really working on when you're using these reinforcers and you're working on communication is you're working on them telling you in a way that feels good to everybody. So if your child can come up to you and say, Mom, fruit snack, and you can give them their bag of fruit snacks, that feels so much better to everyone, including your relatives, than if the fruit snacks are required because he's kicking and screaming on the floor. So what we want to work towards is finding a way to make requesting those things that he wants, that he's willing to work for, easier than that challenging behavior, that whining, the please, I need the iPad now kind of behavior. So it is tricky. It takes some getting used to, because it can feel in the beginning like, this kid's getting everything. They've got the whole treat drawer is available to them, but capitalizing on those naturally recurring reinforcers, those things the kids really want, can get you so much value in terms of getting some communication skills, getting some waiting skills, some attending skills. A really valuable reinforcer, something they're really excited about, can be just like magic. So I feel your pain. I know exactly what you're talking about, but I would keep on with working towards those requests, towards those reinforcers. These are great questions.
Another thing I'm just thinking of I'm thinking of your example of the drawer. So if we know that every time the kid goes toward the drawer, they're going to want fruit snacks, what you could do is catch them before. So let's say they're heading toward the drawer, they're getting ready to maybe scream, and you say, fruit snacks? Did you want some fruit snacks? You can say yes. And if they can say yes, that's good. If they can give you a a head nod, if they can give you a clap,
Right.
what literally anything can be communication, as long as it's not screamy yelly, right? So that might again feel better, right? Because you're ready to pounce on the opportunity instead of they're already at the drawer screaming and tugging and trying to get in and all that. Because then you get the judgment from the relatives. We don't want that.
That's a great point. So the next question says, my son has a lot of sensory problems. He likes to chew items that are potentially harmful, and the school is not helping me. He bites his sleeves and crayons. What can I do? Okay, so the first thing I always suggest if your child's eating non-food items is to check in with our doctor about it. This can sometimes be a medical thing. So it's always best, if anything to do with food and feeding, to just check in with the doctor first. Past that, my suggestion would be what we call a replacement behavior, or something that basically give him access to something at school that he can put in his mouth, and then teach him the difference between it's okay to chew on that for now, and not okay to chew on crayons or things that could hurt him. That would be my my first piece of advice. But I would check in with a doctor, just because sometimes when kids chew on stuff, it can be telling us that they need something else. Okay. The next question is, do we have to be referred by a doctor for these services? So that's a great question. One of the easiest ways to get referred to early intervention is through talking to your pediatrician, your doctor, but you do not have to go through a doctor to be referred. Anybody can refer a child for services using Child Find, that phone number that Hannah put in the PowerPoint. If you want, you can talk to if you have a daycare provider or a trusted teacher, somebody like that can help you with it. But I would call that number and go through the Child Find process if you can't go through your doctor for whatever reason. Is there a waiting list to be tested for these services? Unfortunately, yes, there likely is a waiting list. I'm not as familiar with services in Alabama, but I know in Georgia and Oregon, there is a waiting list, which is why I suggest that people, if you have a suspicion that your child needs services, don't delay in getting the process started, just because it can be pretty lengthy, and the pandemic didn't help with that, I'm sure. So this question says, can early intervention address concerns about a child being picky and only wanting to eat a few foods? He's below weight for his age. So yes, if your child qualifies for early intervention and is receiving early intervention services, they will have someone who can help with these kind of things. Usually feeding or eating is not sufficient to qualify for early intervention alone. Sometimes, but usually unless it's also part of some other delays. But if you're working with an early interventionist, particularly if you're working with a behavior analyst like Dr. Drew, they can help you with some strategies to support picky eating, or food selectivity, as we call it. I do not think that the next question is that document in Spanish. I do not think we currently have it in Spanish, but I think we could potentially work on that, getting the resource document in Spanish.
I could translate the resource document into Spanish if it is okay with you guys, and we could send it to the families.
That would be wonderful. Thank you so much. The next question is, when you talked about the areas, can you give examples of delays in social areas? Yeah, so when we talk about developmental delay, we're usually talking about 4 or 5 areas. We call them domains, but areas is just as good. These are usually motor skills. So gross motor being running, walking, throwing a ball, catching a ball, all those sort of big motor movements. And then fine motor, which is holding a pencil, being able to pick up something with 3 fingers, being able to manipulate your fingers. Those are sort of one area. You're often going to get support from an occupational therapist or a physical therapist to work on those areas. Another area is cognitive. So that's how your child learns. This is things like, are they understanding basic logic? Are they knowing where to look for something if it's missing? Can they follow multiple step directions? These sort of beginning skills, we call cognitive skills. Then there are adaptive skills. So adaptive skills, it's anything that you need to get by in day-to-day life. So for very young kids, it's things like being able to vocalize when they have to go to the bathroom, being able to zip up their sweatshirt or help you put their clothes on, being able to communicate if they're hungry or cold. As kids get older, these become things like job skills, independent living skills, things like that. Then there's communication. So communication is any type of communication ability. So it starts with vocal speech, like I'm using now. For some children, they may never communicate using vocal speech, and they might learn to use a device which will talk for them, or they might use sign language if they are deaf. But communication covers all ability to both understand and also initiate communication. And then there's usually a social domain. So social domains early on are basically the child's relationship with their caregivers. So do they look at you when you come in the room? Do they follow your eye gaze if you look at something? Are they interested in being around you? Is there basic turn taking happening? Those types of things. But as the child gets older, this becomes interactions with peers, with their friends at school. So can they share resources? Can they talk to their peers? Are they forming friendships? Are they, taking turns? Those types of skills. So those are really the big domains that you hear about when you hear about these areas of delay. So delay could happen in one or more of those areas. And when we're talking about early intervention, a lot of times we're just talking about a delay. So it might not ever lead to a diagnosis. It might not ever be that your child has a label like they have autism or they have an intellectual disability or anything like that. It could just be that they have developmental delay. Some kids catch up and progress without any necessary support. Some kids are going to go on to receive a diagnosis in some area. Okay, the next question is, if a child receives early intervention, can Medicaid pay for more therapies like speech? I feel twice a month is not enough. I do not know the exact rules around speech. I believe in some situations, depending on what your child needs support with, it can sometimes cover speech, but I do not. That would be a question for your insurance provider or for Medicaid directly. I know they do cover some autism services if you can get it lined up. This question said, the doctors first told me that my child was delayed because he was learning a different language, English, and spoke Spanish at home. But I didn't listen to him and asked him to just give me the referral, and my child was behind even in Spanish. Yes, that is good intuition. There is sometimes a little bit of delay in language when a child's learning a second language as a young child. We call this sometimes the silent period, where they might just go through a little phase where they're not really communicating too much in either area. But the important thing about this is exactly what you found out and you got the referral, is if this is due to second language delay, you won't see a tested delay in the first language. So you might not see a lot of expressive language. They may not be communicating a lot out loud, but if it's tested, they have the intact language in their primary, their home language. It also typically looks a little bit different than actual language delay when you have a delay due to second language learning. There are usually things that come with language delay that you don't see when the child's learning a second language, like frustration, inability to communicate, challenging behavior. Usually these things don't come up with second language learning because they have a modality in which they can communicate. What recommendations can you share with me to help my child increase her speech at home? I would recommend working on that into everyday routines. So kind of like Dr. Drew was talking about before, if your child wants a cookie from the cookie jar, that's a great time to work on the word cookie, right? Because the motivation is right there. She's super interested in getting that cookie from the cookie jar. If your child has a routine where they like to watch the same TV show after school, you can wait to turn it on just 2 minutes and see if you can get her to say on or something simple like that. And then as you do these things, as these opportunities come up, over time, you can build it to be more and more complex. So maybe after a while, when she's always saying on, when she wants a TV show on, you can wait and have her say, turn it on, and model these phrases for her. So my number one suggestion would just be to build it into everyday opportunities as much as you can. Because there are really motivating things that happen across our normal day. And if you can capitalize on those, then you've not only taught her to use more language, but she's going to keep using it because it's part of her everyday routine. When you call to make a referral for early intervention testing, how long is the waiting time before they call you back? It depends. I wouldn't be able to speak to that in Alabama. I know sometimes it can be very severe. Very long. Sometimes it can be quickly. I know that everyone's working very hard to get to you as soon as they possibly can. So I would say don't be afraid to follow up if you don't hear. But it might be a little bit of a wait. This question says, how can you work for the children that are not verbal at all and have a mental disability, very severe? So, no matter what is happening with the child, no matter how significant their support needs are, these same basic strategies are helpful, right? You just need to move the target a little bit. So if you're not working on someone saying, turn it on, maybe you're working on them hitting a button that makes a noise for them. Maybe you're working on them just pulling up their pants instead of, putting them on themselves. You can make the goals more attainable, but the same basic standards of, providing opportunities, providing moments when those reinforcers, those rewards are super clear because it's a part of their day-to-day, that's always going to help. And then if you aren't working with an early interventionist or that your child's not receiving services, I would say start that process as soon as you can. Is it true that if a child was born premature, he can be at risk of having a delay? Yes, and that is true. Children who are born premature, depending on how premature they were born, are considered, if they were significantly premature, they're actually considered eligible for early intervention services. And if they're just slightly premature, sometimes that doesn't work out to any delay whatsoever. Sometimes there is a noticeable delay. It just depends. It's depends very much on the child and how they develop. But it is what we call a predictor, or something that tells us this might be a good time to keep in touch with your doctor to track how they're developing, and just sort of keep an eye on it. Oh, we got a compliment, Hannah. It says, thank you to Dr. Hansen and your student. You explained it very simply and it was easy to follow up. Excellent. That is all the questions that I see here. I'm happy to share my email if that's helpful, or you can contact Dr. Drew and they will know how to get a hold of me, or Hannah. Thank you for your time, everyone. I really enjoyed it.
Those are all the questions that I have, Dr. Hansen. Very good questions. Congratulations.
Excellent questions. Yeah.
I do agree that the way that you guys presented it, it was very easy to understand for us. And so thank you. So unless anybody else has any other questions, I just wanted to say that we'll be sending the link recording and also the PowerPoints that have been translated into Spanish. And I will work on the resource list so that it will be sent at the same time. I also want to invite our parents to please fill out the survey links, because that helps us with our grant. So please let us know if you guys have any questions. I could also add Dr. Hansen's email and Hannah's emails as well on the email that will be sent. Will that be okay?
Absolutely.
So one more thing, Dr. Drew or Dr. Hill, can you please put the H-Strand YouTube channel link on the chat? And so I would like to invite the parents and professionals to go to our YouTube channel to subscribe, because every presentation has been uploaded there. We had a little bit of a hiccup with the last one. We were it was breaking down, so it took us a while, but all of the presentations are there. And so thank you, Dr. Hill, Dr. Drew. So please go into this link and subscribe. That way you will get a reminder once a presentation has been uploaded. So Dr. Drew or Dr. Hill, would you like to say anything?
I just wanted to thank everybody for coming, and I'm looking for the link right now, unless Christine has, or Dr. Drew has better access. But
I put it in the chat for everybody.
Thank you. I wanted to thank Dr. Hansen and Miss Hannah for great resources, and Maria for saying she'll translate some of them into Spanish. And I wanted to thank Miss Du, who is our Korean interpreter, who has been standing by in the airport in Korea, probably Seoul, maybe. And we always appreciate her and her diligence and how she's so much a part of this program. And Miss Maria Baker and Miss Iris Mobius, who have been our Spanish interpreters. You guys always do a wonderful job, and we are so appreciative of that. And then to remind everybody, on 19 April at 10 a.m., we will do this again. That's all I have.
Thank you. Dr. Drew?
Just wanted to say thanks to everyone. And again, if you have any questions, you can email any of us or the Regional Autism Network, and we can connect you with some other resources. And we're happy to provide this again I guess in 12 days. And that will be during the day. So we always get great questions at the end. So even if you have heard the presentation, if you come in at the end, you'll hear other parents' questions, which may answer some of your questions. And just like we had great questions today, I'm sure we'll have great questions the next time.
So thank you, everybody. I hope that you guys get to enjoy the weekend. Stay safe. And thank you, Hannah and Dr. Hansen, for today's presentation. We'll see you in a couple of days. Thank you, everybody.